So good evening, everybody. Thank you for joining us today. And we're here from New Horizon Family Health Services to take some time to talk to you today about PrEP, pre-exposure prophylaxis, which is a method of preventing HIV. And if you're somewhat familiar with the world of HIV and what's been going on, treatment and prevention methods have just been expanding and becoming more and more user-friendly and safer all the time. And so we're excited to talk about a way to prevent HIV and keep people safe, excuse me. So to start out, my name is Scott Brown. I am the Ryan White Program Director here at New Horizon Family Health Services in Greenville, South Carolina. And we cover a large area of the upstate of South Carolina. We draw the line over at Spartanburg, but we do have wonderful friends in the Spartanburg area that we are connected with. And so while we were talking today, if for some reason you may not be in our area or you're interested in who else is out there, we are also always happy to help you connect with service providers. And so I'm going to take a minute and let these other two wonderful people who are in the program with me introduce themselves and the role that they play. And I'd like to start with my clinical partner to the left here, Miss Serena, also known as Hope Adams. Hope you've got to unmute yourself, dear. Thank you.
Okay, hi everybody. My name is Serena Adams, but everybody calls me Hope. That's my preferred name. I'm here to talk to you today about PrEP. Specifically, I am the PrEP Navigator, and I'm anxious and excited and to answer your questions. And I am my official title is pretty long, but it is the clinical promotion health specialist as well as PrEP Navigator. I'm a registered nurse and a certified case manager, and I'm here to answer your questions and walk you through the clinical process. And now I'll skip to Annette.
Thank you so much. Yes, and over on the bottom of the screen from where I'm looking, we have Miss Annette Walker, and I'll let her tell you all about her role in this group.
Good day, everybody. My name is Annette Goodwin Walker, and I am the clinical pharmacist working with the PrEP program. My responsibility specifically is to ensure not only talking with patients about side effects, but also to make sure that the patient can get the medication, whether it's via insurance or whether it's via through patient assistance or through another program that was sent down, which is called Please Prep Me. I think it's part of the ending the AIDS epidemic. So my goal and my role is to make sure that you get your medications and you take them daily. Thank you.
Yes, and Annette will check with you to make sure you're taking your medications daily. No, as far as I know, we are not here to be your parents. We are not going to hound you about PrEP services, but we do want to encourage people to take the medication as prescribed if you decide that this is something that is right for you, because that is the best way to have the highest efficiency of protection, highest level of protection, if you will. So we have some areas that we want to talk about today. And one of the things we're going to start out with first is what is PrEP? And so as I said in the beginning earlier, PrEP is an acronym. So the PrEP, or pre-exposure prophylaxis. And so just as the word says, this is a medication that is designed to be taken before you are exposed to an HIV virus that could potentially cause an infection for you. And so that's how they kind of came up with that name. So there are some risk factors and there are some ways to take it. And so first of all, and I'm going to put Hope on the spot. I know she's just dying to talk about this. So So Hope, talk to us a little bit about what some of the risk factors may be. I mean, who could potentially be at risk for HIV, and what should they be considering?
Well, HIV, it pretty much affects the gamut of people in generally. The HIV drug users. There are drug users. I'm sorry, I'm a little nervous here, but there are. It affects everyone, whether you've had partners in the past, multiple partners now, or you have someone in a relationship that has had a history of multiple partners as well, or you have an open relationship, whatever your relationship is defined as, whether it is with a significant other, regardless of sex, regardless of gender, I should say. It affects potentially everyone if it's not treated. And one of the things that we try to do is prevent it from spreading, but we also, in the process, we want to prevent sexually transmitted diseases as well, because that also compromises the immune system, and we want to keep people safe. So that's our goal.
Okay, and I do agree with you, Hope. What you were saying is any individual who potentially is in a situation in which they are engaged in any type of physical sexual activity with another human being, regardless of the gender, the type of relationship, without knowing the other individual's full history, you may or may not be at risk. The population most at risk, according to the data, according to information that we collect, is the population with a younger African American males who are considered what they call MSM, or men who have sex with men. They are the population that is at most risk, and so we hope to reach them and help them stay safe and stay healthy. And we'll talk a little bit more about that. But I'd like to turn to Annette and just have her talk about the current medications that are being used in PrEP, kind of where they came from, how did we get here, and tell us about how they're taken and their effectiveness, maybe.
So there are currently two medications used for PrEP. There is Truvada. Truvada's been out for quite some time. It is a once-a-day medication. And there's also Descovy, which is a newer medication. Both of these medications are used in HIV, but they're also used for pre-exposure prophylaxis to prevent HIV. But both of the medications, Descovy and Truvada, are taken once a day.
And if they're taken as prescribed in that, how effective are they at preventing HIV?
When taken daily, they are 99.9% effective. So we encourage everybody to take their medications daily.
So there's that little piece in advertising that says you can't say 100%, but it's pretty darn close, isn't it? Right. So Hope, in knowing that we're taking medication to prevent HIV, we also, in treatment, we monitor certain body functions to make sure that the medications are not having any adverse effects on our patients. Can you tell us what some of the basic areas that you're monitoring as a clinical individual to make sure the medications are not causing any harm?
I'd be happy to, Scott. What we currently look at, and CDC is always looking at evaluating to find out what's the most effective labs and most revealing labs for the patient to make sure that they're safe, is we look at the creatinine clearance. What we're looking at is kidney function, liver function, but basically we want to make sure the kidney function is good, because some of these medications are better for other people, and whether it's just one might be better for Descovy versus Truvada, depends on your medical history. And your doctor would review that. We look at your basic metabolic panel to look at your general overall health, how your sugar, other things that are going on, your glucose level, your sodium level, just generally like a general overview. And it also gives us a real basis for how your kidneys are functioning. And then we also we do kind of standard tests just because it's just kind of routine. We want to make sure, as I said, that you're healthy, and we want to make sure that that there are no sexually transmitted infections to compromise your health. And so we kind of standardly look at that as well. But we always, every 3 months, we always take HIV tests. We want to make sure that you're negative, because we don't want any medication to compromise your potential effectiveness. Like if you did contract HIV because of whatever situation and you contracted HIV, we need to know that you're safe. So we look to make sure that you are HIV negative before you can go on this medication, and we want to keep you safe. So we just watch that because we don't want you to run into resistance problems with the medication.
Great, thank you, Hope. Yeah, certainly. It sounds like what you're describing is lab tests and other things that even if you were seeing your doctor, your primary care physician on a routine basis, they're going to be checking these types of things anyway and making sure that everything's going well for you. And so they're not too far out of the ordinary from what I understand. We may just do it a little more frequently to make sure you're safe and sound. Now, before I move on, I want to double check with a good friend Annette, because she knows a lot about medications and how they interact in the body, and just see if she has anything else she'd like to add to that discussion.
So just briefly, Truvada can have some side effects where it affects the kidney. So we don't like to, if your creatinine clearance is below a certain level, we would choose not to use Truvada. We would choose to use Descovy, and that would be for men, MSMs. There's not studies that are out there specifically use Descovy for women, but right now we are using, I believe the creatinine clearance is 60 or more. We're using Descovy, and anything 30 below, I might be saying that wrong, so sorry. We're using Descovy for creatinine clearance issues, and if you don't have creatinine clearance issues, I am saying that all wrong. Pardon me. So we are using Truvada initially for PrEP. If you're having creatinine clearance issues, then we're going to use Descovy.
Okay, I won't put you on the spot again. So, yeah, and both medications have been used long term now. They were originally used in the treatment of HIV, as Hope was saying earlier, and they were shown to be very effective in preventing HIV. So we know they have a long history of being used. We know they have a long history of being safe overall, but that's not to say that you should let your guard down. Medications are medications. Everything affects individuals differently, and so we're here to make sure that those medications do not have any negative effects while you are taking them. So speaking of that, we have a little presentation. Well, we got some pictures we're going to show you. And what we're going to show you are just pictures of individuals. So I'm going to let those pictures pop up on the screen now. And as they're coming up, we'll talk. So here's the first picture. And so what I want you to be thinking about is, as you're looking at the photos of these individuals, and we're probably moving into the second picture now, what do you see in the photo? Who do you see in the photo? Let's move into the third photograph. It's a fine-looking gentleman. And then we're going to go to our very last picture. Now, hopefully I didn't get those out of order. And there's a wonderful elderly lady. So probably could be my grandma. I'd be very proud. So here's the question. Which one of these individuals or in the pictures that you saw, who is appropriate for PrEP treatment? So hope or not. I mean, do either one of you have a comment on that?
I do. I talk to people all the time about PrEP, and it's my job to see whether or not PrEP is right for them. And one of the things that I found that there is no one person that PrEP is right for. It's right for everybody. I mean, potentially everybody could benefit. So when you think of, like you mentioned, it might be your grandmother. We think of the elderly population or older population. I hate to say elderly, but when we think of the older population, a lot of people may or may not know how active people are. Well, you're active throughout your lifetime. It doesn't stop just because you get older. And because you're older, and hopefully we get wiser as we are aware of different things, or we may not be, but we're hopefully like sponges. We want information. And so we look for ways to stay healthy, and PrEP is one of those ways. And so it can potentially benefit all these people.
I also have something I would like to say. Just knowing, this is just a little story I want to tell. A mom had come to me and asked, she was concerned about her child and being on PrEP, and the friends that were around her child, and their child was an adult. So I would just say her adult child. And I encouraged her to be the empowerment specialist to share the information. So anybody who is having risky behavior can qualify or can start PrEP. So anybody who's sexually active can start PrEP. And I encouraged her to share that information with people she came in contact with.
Yes, absolutely, Annette. Thank you so much. Thank you both for that, because you're absolutely right. HIV, the virus itself, doesn't discriminate. A human body is a human body. It doesn't matter what gender you are. It doesn't matter what socioeconomic group you come from. It doesn't matter whether you have insurance or you don't have health insurance. It doesn't matter if you're black or white. It doesn't matter, all of those factors. If it finds its way to you, it's going to make a home inside your body. And unfortunately, the human body is a wonderful place for HIV to live. It really likes what we have to offer, apparently. So keep that in mind. Think about, where am I in my life right now that could potentially put me at risk. Certainly, there are individuals out there who may have very low risk factors. And for you, PrEP may not be something that you're concerned about, and that's okay. But for those people, if you question whether or not you could potentially get exposed to HIV, if you've even had the thought, talk with us, get a hold of us. Let's talk about what your risk factors might be and whether or not PrEP could be a good option for you. I'd rather explore the potential of you being on PrEP in a conversation than have to have a conversation with you about starting new HIV treatment because you've already become infected. So keep that in mind, and we can certainly talk more about what that means. So a lot of people talk about, if I make the decision to go on PrEP, I know that I have some risk factors. I want to be safe. And taking PrEP may even be a temporary thing for me. Maybe those risk factors will change over time. This doesn't necessarily have to be a lifelong treatment that you stay with, but you stick with it in a time when you may be at highest risk. How do I make that decision? How much is this going to cost? What if I don't have insurance? I mean, there's so many questions that come to mind. Hope was talking about lab testing that needs to be done. My goodness, what if I have to pay for that? How does that all work? And so the million questions come to mind, and there's probably a lot of reasons why we might say, I don't know if I can do that. Or, geez, I don't think I really have the money. Well, if you feel PrEP is right for you, we've got some options for you. But I'll open it up to my coworkers here to say, what are some of your thoughts on, Annette, I'll kind of reach out to you first. When you're thinking about PrEP medications, I mean, anytime you think about a pharmaceutical medication, we know they're not free most of the time, and they can be rather expensive, especially if they're not a generic drug of some sorts. But we've got options to help pay for things, don't we?
Yes, at this present time, there is a program called Please Prep Me. And basically that particular program, we fill out an application and we apply you for it. And once you're accepted, then you can get the medication for free through special pharmacies within the Please Prep Me program. They have designated pharmacies that the patient can get their prescriptions through. And then for those who have insurance, there is also a copay program, which is through Gilead for both of the medications, Descovy and Truvada, that we can get a copay card to decrease the cost of the amount of the prescription every month as well. So there are two options at this time.
Wonderful. So we know that there are options to help cover the cost of medications or even copays or out-of-pocket costs that your insurance may not cover. We have options for that as well. So that's good to know. Nothing worse than considering something that could be a life-saving medication for you, prevent you from an infection, and realizing you can't afford it. I mean, we wouldn't want people to be in that situation. So we can help you with that. So Hope, if somebody makes that decision, how are they getting a prescription? How do they get PrEP medication, and who's going to be monitoring them besides you as a PrEP navigator?
Well, we're a team. Okay, first of all, just know that we are a team and we work together for the benefit of our patients. We always put our patients first. And so that includes not just the three of us, but our whole community. When I say our whole community, we have some of our, some people that are patients or people who are inquiring have positive partners. And so we may work with the Brian White on one end where their partner is working with them. And at the same time, they may want to be on PrEP to also reduce that risk of contracting HIV. So we work with our providers. We work with the drug company, as Annette said, we work with the drug company. We work with the pharmacies. We work with our lab here. We establish our patients here underneath primary care, so they're followed closely. We do monitoring labs every 3 months. I'm available 5 days a week, at least at this point, maybe 6 soon, who knows, but at least 5 days a week, where you can ask questions. And I'm always available by phone. You can also reach me by email, and I'd be happy to answer your questions. I also, a lot of times questions come up after you start, or, I'm curious, how long do I have to take this before it's effective? Okay, well, if you're a man and men having sex with men, it's 7 days, 7 days before you can actually have sexual relations, because you want to make sure that you're safe and you take it 1 pill every day. Okay, and you continue to take that. For women, for vaginal intercourse, it would be 20 days. 20 days before that effectiveness reaches that. You have to have the strength within your body. You have to reach that therapeutic level. But those are some of the questions. The other questions I have are, how come I have to use a condom? I've heard that a lot. Well, it may prevent, PrEP medication may be 99.9% effective, but it doesn't prevent sexually transmitted infections. And that compromises your immune system, makes you unhealthy. It's our job to help you help yourself make positive choices. We'll guide you. We'll also answer your questions. If we don't know the answers to your questions, we are a team. We will seek out each other and get those answers for you. So you rest assured, before you leave, we will answer all your questions to the best of our ability. And if we can't answer them, we'll be honest with you and we'll tell you, I don't know that answer, but I'll get back to you and I won't leave you hanging. And we mean what we say.
We do, and I appreciate that. Oh, absolutely. We are a team, and we do want to give you the most accurate and timely information possible. And as Hope was stating, we'll establish patients here at New Horizon Family Health Services. We're going to establish you with a primary healthcare provider that can monitor that prescription and monitor your health. And it's kind of Hope's role and responsibility. She's kind of the go-between. So she's not only checking in with you as the patient, but she's also keeping your primary care provider up to date. So you got a friend in the business kind of looking out for you as well. So that's a good thing. And if you have any issues with getting medication or finding a resource, whatever, that's why we've got Annette on board, because if there's a way to find it, Annette's going to find it. She's got a really big magnifying glass. She snoops it all out. I'll tell you what. So getting on PrEP can be as simple as getting established with a primary healthcare provider. We have those providers here if you don't have one already. If you do have a primary healthcare provider already established in the community, you may want to talk to them about PrEP. They probably already know about these medications and how they can be used. So check with them to see if they can provide that as well. Don't be shy about it. If the conversation goes great and things go well, that's fantastic. If you don't get such a warm, fuzzy feedback that you were hoping for, we're here for you. Not that we want to be running around, collecting all the patients in the world, but we want you to get what you need so that you stay healthy. And so if there's anything we can do to keep you healthy, that's what we're going to do. So we're going to kind of wrap things up. Let's see, we've been talking about who's right for PrEP, what is PrEP, how do you get on it? We talked about medication, some of the things you may need to do as you're taking PrEP to monitor the lab work, monitor your kidney function, your liver function, all of those fun things. A lot of things that you would do normally with a primary healthcare provider. So maybe a little more frequently, but not necessarily out of the ordinary. So how do you reach us? So we're going to have on the screen, we have an email address that's going to pop up. It's a general address that is checked on a daily basis, and they will direct messages to us. We'll reach back out to you. We can reach out to you by email. We can reach out to you by phone. We can even text message you. We have the technology, huh? How exciting. So, different ways for us to check in with you. So one of the most important things to do is start with know your status. Get a rapid test for HIV. We have them, no charge. Stop by anytime. See the health department. They'll also help you with those things, and report back to you and let you know what's going on. Talk to us about PrEP. How do you end stigma? Well, don't be afraid to talk about PrEP. Don't make it a mystery. Any closing comments? Annette, Hope, I'll start with Annette. Anything else you'd like to share today before we kind of wrap it up?
The only thing that I would like to share is just know that New Horizons staff, we're here, we're in your corner, and we're fighting for you and with you. And we'll walk you through the steps to get the care you need to prevent HIV.
And Hope.
I just want you to know that we're concerned with, we want to promote positive sexual health. And this is an environment without judgment. We welcome all, and we hope that you will reach out to us because we're excited to have you. Thank you.
Well, thank you so much. I appreciate you guys taking the time to join me today. Thank you to all of you who were part of this conversation today. I hope you will reach out to us if we can answer questions for you or do anything to provide you with quality, thoughtful information that will help you to make the right choice. We want you to stay safe. We want you to stay healthy. And we want you to know that we will be here for you. So thank you, everyone. And hopefully we'll do this again real soon. And we'll talk some more about preventing HIV and what's new in the world, because there are some new things coming down the line. Things are changing all the time. So don't forget to wear your mask, stay safe, and get a hold of us if you need us. Good night, everybody.